and skull, we have condyloid processus, condylus occipitalis. They join together with superior articular surface of atlas. Yes, fova articularis superior of atlas makes joint with condyles of occipital bone. This is, tell me, is it simple or compound? Simple, because two articular surfaces, simple joint. Then this here it is one joint and here it is another joint, but they work together. That is why both of them combine joints. Then that is condyle. That is why type of this joint is condyloid joint, and it is biaxial joint. Biaxial movements. We can move head forward and backward in frontal axis, and move head laterally, move it to the right and to the left. Two axes of movement. And between occipital bone and atlas, we have another example of syndesmosis, that is membrane, anterior membrane and posterior membrane, that is syndesmosis. Membrana Atlanto-occipitalis anterior and membrana Atlanto-occipitalis posterior, two membranes, anterior and posterior membrane between atlas and occipital bone. And last, three joints between atlas and axis. Here it is, we have three joints. One joint between dens of axis and anterior arch of atlas, that is articulatio Atlanta axialis mediana. Here it is. And laterally, here and here, we have articulatio Atlanta axialis lateralis. These three joints, one is unpaired and two paired. Unpaired joint, that is simple joint and cylindrical joint. And lateral joints, they are simple and plane joints. Usually plane joints are multi-axial joints, but cylindrical joint always is uniaxial. And these three joints combined together, they are combined joints. That is why all of them has only one axis of movement, that is vertical axis. And in vertical axis, we can move atlas, in this case, atlas around dens of axis. We move it laterally to the right and to the left. In this joint, we have some ligaments. And most important ligament, that is ligament between left and right lateral masses behind of dens, that is ligamentum transversum atlantis, transverse ligament. Why it is so important? Because this ligament, it's protect spinal cord from dislocation of atlas. If this ligament will broken, atlas can move forward and destroy spinal cord. That is very dangerous for human life. That is why it is very, very important ligament, transverse ligament of atlas, ligamentum transversum atlantis. From this ligament upward and downward, we have vertical fibers, and this vertical ligament is ligamentum cruciforme atlantis. It's look like cross. Transverse ligament together with vertical fibers makes ligamentum cruciforme atlantis. Next ligament, from apex of dens to upper part of foramen magnum, we have ligamentum apicis dentis. And laterally from dens to foramen magnum, we have two ligaments. They look like wings. That is, they are ligamenta alaria. Ligamenta alaria. Ala, that is wing. Ligamenta alaria. And all of these ligaments close with the help of membrana tectoria, tectorial membrane, membrana tectoria. That is articulation between skull and vertebral column. Here it is 5 joints, 2 Atlanto-occipital joint, 2 joins Atlanto-occipital lateralis, and one joint, articulatio Atlanto-occipital mediana.